Hi everyone, Dr. Emi from Pain Free and Fit and Posture Size. Today we're going to be talking about stretches for retrolisthesis of the lower back. Hope you enjoy. So retrolisthesis, which is a backward slippage of the vertebral bone spinal segment in the lower back, is the opposite of antero or spondylolisthesis. Many times retrolisthesis is due to degeneration, the discs have degenerated, post-surgically at the end of a fused segment. There's a lot of reasons for it. But one of the more common theories that's evolved about retrolisthesis is that it's a compensation for a loss of pelvic angulation or pelvic tilt. The pelvis, when it tilts posteriorly and loses the natural curve or lordosis in the lower back, is usually associated with retrolisthesis. There's a more flat back, a straighter low back, and not as much of a curve in the back that bulges anteriorly. This loss of lordosis puts more pressure on the discs, and in individuals that can't compensate for this, what they do is they move their vertebra backwards in an effort to anterior pelvic tilt. Normally that curve or that lordosis is the healthiest biomechanical strategy for the lower back to be able to handle stresses across it, the joints, the discs, all the soft tissues. But when there is an inherent decreased tilt and an individual can't increase the tilt, meaning raise the tailbone or lower the pubic bone enough to increase the arch in the back, the body compensates for this inability to compensate with the pelvic tilt by having that retrolisthesis move backwards. That brings the center of gravity of the upper spine backwards over the lower spine and artificially increases the arch of the back. Unfortunately, that puts pressure mechanically on that vertebra and all the soft tissues around it with that retrolisthesis or sliding back. So one of the ways that we can address this with exercise is by using certain stretches that help to induce that lower pelvic tilt, that pelvic inclination. Many times when the pelvis is posterior pelvic tilted, meaning that the pubic bone is higher than the tip of the tailbone, posterior tilt, and the back is flat, the muscles that are holding it there are tight hamstrings, tight buttock or glute max muscles, and tight abdominal muscles, the superficial rectus abdominis and the obliques. So by stretching these muscles, we'll help to take the muscular tension away of the hold of that posterior pelvic tilt and allow the posterior pelvic tilt to start increasing, meaning an anterior pelvic tilt, lowering the pubic bone and raising the tailbone, enhancing the curve or the lordosis of the lower back, and decreasing the stress or compensation that's driving that retrolisthesis backwards. So these are the stretches. For the abdominals, you can stretch straight backwards, trying to hold your pubic bone down so it doesn't lift up as you lean backwards. You can put your hand on your pubic bone with that, and just try to tilt your lower rib cage on the front of your body up and backwards till you feel a mild pull on the abdominals. You can also do that face down, where you're laying on your stomach and raising up, making sure your pubic bone's not moving with you, trying to seal it into the bench and arching upwards to raise your lower rib cage up, feeling a stretch in your stomach or your abdominals. For that will address the rectus abdominis, the front abdominal muscle. You can also target the oblique, the external oblique, by tilting backwards with your hand behind your head on one side and rotating into that side. As you rotate in, you'll feel a little stretch on the front side of the abdominal. Again, making sure with a finger on your pubic bone that your pubic bone isn't going along with movement. You're trying to stabilize that right there as you're moving up and back to target the external oblique. The buttock or glute max muscles, which also support posterior pelvic tilt position, can be stretched by bending one knee up and across towards the opposite chest, feeling a stretch in your buttock or hip area. And finally, the hamstrings can be stretched by holding your thigh perpendicular to your body as you lay face up and straightening your knee, an active stretch, which is a safer stretch for the hamstrings, until you feel the stretch behind your hamstring muscles. All of these stretches you want to make sure you're holding for at least 15 seconds, but preferably you want to be holding them until the feeling of stretch in the muscle fades away. Then you're going to go a little further in the stretch, do a second, and after another 15 seconds, up to a minute or two, when that stretch fades, a third stretch. Doing these stretches 2 to 3 times a day can help to unravel the tightness that's in these supporting muscles that keep your body in a posterior pelvic tilt and allow you more freedom of movement to anterior pelvic tilt, thus taking away the secondary compensation of the retrolisthesis and affording you less soft tissue stress on your retrolisthesis lower back pain. If you like this video on retrolisthesis and stretches, feel free to subscribe to our channel. We have a lot of great videos out there on spinal stability. If you're looking for a great program to stabilize your lower back with specific custom exercises, check out our low back healing exercise program available at painfreeandfit.com. It has all the stretches, core individual exercises to strengthen and stabilize your back, how to get back into fitness, all while customizing a program based on your unique mechanics. I hope this video on stretching for retrolisthesis helps you with your chronic lower back pain.